Hi, I'm John Silcox with the Fairfax County Health Department. I'm here with Dr. Benjamin Schwartz, who's our Director of Epidemiology and Population Health, and we're here to talk about a really important topic, one that you've probably been hearing about in the news, which is an outbreak of lung illnesses associated with the use of e-cigarette products, often referred to as vaping, the use of those products. And Dr. Schwartz, we want to just get a little bit of an update on what's going on with this outbreak. Can you give us kind of a status report?
So national numbers at this point suggest that there have been over 1,000 cases of serious lung disease around the country associated with vaping. In Virginia, 50 cases have been identified, and in Northern Virginia, the area where Fairfax County is located, there have been 18 cases.
So we thank you for tuning in today, and if you have any questions during this broadcast, please leave them under the comments section. We'll be happy to try and address them. But as you just mentioned, the outbreak continues, and we're seeing increases in case numbers from week to week. How serious are these illnesses? Can you talk a little bit about that?
Illnesses can be very serious. There already have been a number of deaths associated with this disease. Many people have required hospitalization and intensive care with help breathing with a mechanical ventilator, and others have also been hospitalized but not required this ventilation. We don't know the long-term effects of the disease on people's lungs or how long this damage may exist.
And what do we know about the people who have become ill from using these products? Do we have any sense of who they are and any more information about their profile?
Most of the people are young. They may be adolescents to young adults. They are more often male than female. Most often they report vaping products containing THC, which is the active ingredient in marijuana, although some of them also say that they've only vaped products containing nicotine. Often those products, particularly the THC products, have been bought off the street.
So again, we're here talking about the outbreak of lung illnesses associated with vaping, and I'm here with Dr. Benjamin Schwartz with the Fairfax County Health Department. We appreciate you tuning in. We hope you'll like and share our video. Dr. Schwartz, at this point in time, what is the CDC recommending that consumers do?
The CDC most simply recommends that people refrain from vaping while we figure out what the cause is of this serious lung disease. They particularly recommend that adolescents and pregnant women don't vape because the consequences of this disease can be particularly severe in those groups. If one does vape, they should not vape products that have been bought on the street or products that include THC.
And Dr. Schwartz, for those who are getting ill from using these products, what are the symptoms of this disease, and what do we want people to be aware of? When should they be concerned or seek medical help?
So the illness typically begins with the onset of a cough. There may be a fever, there may be gastrointestinal symptoms like nausea or vomiting, but the illness then quickly progresses to difficult breathing, shortness of breath, and that's often when hospitalization is required.
And obviously we are tracking cases of this, as you heard earlier, in terms of cases both in Northern Virginia, in Virginia itself, and across the country. So physicians who encounter patients who are experiencing these illnesses, we want those physicians to report that to the local health department. Is that correct?
It is important that cases be reported so that we can not only count how serious the disease is in our area, but also so that we can share information with the Centers for Disease Control, and that can help the investigation to find out what the cause of this problem is.
So if you're just tuning in, I'm John Silcox with the Fairfax County Health Department here with Dr. Benjamin Schwartz, and we're talking about the outbreak of illnesses associated with vaping. And we've been talking about these acute illnesses that are occurring, but we know that there are some long-term risks associated with the use of these products. Can you talk a little bit about that?
Most of the substances in e-cigarettes contain nicotine. Nicotine is an addictive substance. It affects brain development in adolescence, and it also has long-term consequences for chronic diseases such as heart disease. Because most of the people who vape are young and they've only been vaping for a fairly short time, we really don't have a lot of experience with what these long-term consequences will be. But certainly we know from people who smoke cigarettes that nicotine can have very severe impacts.
And do we have any data locally on what's going on with young people in Fairfax County and the use of these products?
There is information on youth in Fairfax County that comes from the Youth Survey, which is a survey of 8th, 10th, and 12th graders who attend the Fairfax County Public Schools. What that survey in 2018 and 2019 shows is that about 1 in every 4 students surveyed reports ever having vaped. And among the 12th graders, so the oldest age group, the proportion is about 1 in every 3. And this number has gone up and up for the past several years. You know, one of the other interesting things looking at the survey is that when these people who report vaping were asked if they believe that cigarettes are harmful, the vast majority of them do understand the harms associated with cigarettes, yet they continue to vape products that include nicotine as well.
So are we seeing that the use of traditional cigarettes might be waning with this population, but the use of these e-cigarette devices seems to be increasing?
It is, and it's one of our concerns that people who are smoking e-cigarettes now, after they become addicted to the nicotine, may go on and smoke traditional cigarettes or just continue the habit with e-cigarettes.
So it'd be very important for parents to have conversations with their children and young people about the use of these products and some of the dangers associated with them.
It's always important for parents and their kids to talk about this type of thing.
So I'm John Silcox here at the Fairfax County Health Department with Dr. Benjamin Schwartz. We've been talking about the outbreak of illnesses associated with vaping, and we appreciate you tuning in. We hope you'll like and share our video. If you have any comments or questions, please leave them in the comment section under the video, and we'll be happy to try and address them either now or after the fact. I guess just in kind of closing here, it'd be important maybe to remind folks about what the recommendations are and what we're suggesting they do.
Mm-hmm. I think the key recommendations are, if anyone experiences the symptoms of lung disease associated with vaping, to contact their healthcare provider, to see a physician, to receive a diagnosis and get the care that they need. The other key message is that while this investigation is ongoing, it's important that people refrain from vaping, and particularly refrain from vaping products that contain THC or are bought on the street.
Well, thank you, Dr. Schwartz, for sharing this important information. We thank you for tuning in. If you'd like more information on this topic or related issues, you can go to our website, which is fairfaxcounty.gov/health, or go to the CDC's website, which is cdc.gov, and you can find all kinds of information about this outbreak, as well as some of the issues around e-cigarettes. Thank you so much for tuning in. We hope you enjoy the rest of your day.